For week 5, we talked about features of psychopathy among youth. When we're talking about psychopathy, we're talking about deficits in or functional impairments in interpersonal, affective, and behavioral domains. So affective functioning refers to kind of how we internalize or view, feel ourselves. So talking about, for example, emotions like callous and unemotional traits. Interpersonal traits are more about how we interact with others, whether we're manipulative, domineering, but also kind of how we see ourselves. So some narcissistic traits like grandiosity and self-aggrandizing. Behavioral domains are about just exactly how it sounds, behavior like sensation-seeking, impulsivity. It's a lot like low self-control. And we care about psychopathy because it's really an important predictor of future offending. Those who are associated with strong features of psychopathy are not just associated with offending more broadly, but we can look at different types of offending outcomes. And we found that features of psychopathy are associated with general recidivism, violent recidivism, a higher frequency of offending, more serious forms of offending, and offending in particular contexts. For example, individuals in custody are more likely to commit crimes in custody if they have strong features of psychopathy. And so this presents a challenge for institutions. In the community, maybe only about 0.5% to 1% of the general population presents with strong features of psychopathy. When it comes to prison populations, we'd find more like 15 to 25% would have strong features of psychopathy. Some will also point to the fact that when individuals have strong features of psychopathy, it has implications for treatment and rehabilitation. For example, individuals with psychopathy might be less amenable or open to treatment. Another thing that we have to consider is that if treatment is being conducted in a group setting, individuals with strong features of psychopathy may be manipulative and may be more likely to use what somebody says during treatment against them. So they could be very destructive during treatment. Another measurement instrument that I'm familiar with and have used in the past is the Comprehensive Assessment of Psychopathic Personality, also called the CAP. And it's comprised of 33 symptoms that are divided into 6 conceptual domains. Those domains are attachment, behavioral, cognitive, dominance, emotional, and self. For the purposes of the final exam, you do not need to memorize all 33 symptoms, but you should be able to describe the CAP in terms of naming each of the 6 domains, and then you should be able to pick one of those domains, and you should be able to name and describe each symptom within that domain. Whichever domain you choose to focus on is up to you, but you should have a good understanding of what the symptoms look like within that domain. So it's not enough just to list them, you have to describe and define them. One of the values of the CAP is that it is scored with 0 reference to criminal behavior, so this helps us avoid some tautological issues. A tautological issue in general is where our independent variable, what we are using to predict our dependent variable, is actually defined by, at least in part, defined by our dependent variable. So if we're trying to use psychopathy to predict crime, we shouldn't be using crime to measure psychopathy. But that's exactly what some instruments like the PCL do. So the CAP tried to address that by focusing more so on interpersonal and affective features of psychopathy. So that's how we measure psychopathy. But before we get to measurement, or if we're going to have a good measure, it's only going to be useful if we can do the interview in the right way. So in week 5, I also talked about interview skills. So talking about how to build rapport when interviewing individuals, how to figure out how to respond to dishonesty, like being the bad cop. And if you catch somebody lying, sort of like getting angry or questioning them about why they're lying might not be very effective and could lead to, for example, poor rapport. So one of the solutions I talked about was that Columbo approach, where you kind of feign confusion and you present the youth, for example, with 2 things that they said that kind of contradicted one another, and you ask them to clarify, what's going on here? Help me understand what's going on. It's also really important to think about the developmental stage of the person who you're interviewing. And this is important for a couple of reasons. One, you might need to adapt questions just to make them simpler to understand. But you also might need to adapt questions so that they're actually appropriate for that developmental stage. So you don't want to necessarily be talking about work for a 14-year-old, for example. When conducting interviews, you also want to be making sure that you're listening to what the person is saying. One of the things that I see that's a mistake like all the time is where individuals will ask like 3 questions at once, or they just can't wait to ask their second question. Like they ask question number 1 and then blah, 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 somebody else is talking. I can't wait to ask my second question. Your first question is going to lead to an answer, and that answer is going to dictate the next question that you ask so that you can have more of a natural conversation. So if you ask the right follow-up questions, you have to have that active listening strategy. And then that's going to be helpful for managing the integrity of the interview, making sure that the person wants to participate, that they're not getting tired, that sort of drain and having to answer these interpersonal questions is not going to actually make them want to just give short or incomplete answers.